You're a part of Laurier's rapid testing program, designed to provide rapid antigen screening for Laurier's students, staff, and faculty. In the next 3 minutes, we'll show you everything that you need to know about the program, including how to administer the test and interpret your results. First, what is rapid testing? Rapid testing is an additional screening method that is used for asymptomatic testing and can help stop the spread of COVID-19 in our Laurier community. It may be performed 2 to 3 times per week and works together with Laurier's other COVID-19 health and safety protocols. Remember, if you have symptoms, you need to self-isolate and consult current recommendations for symptomatic testing with a medical professional. For full information about Laurier's COVID-19 policies and procedures, the rapid testing program, and our vaccination requirements, please visit wou.ca/recovery. This is the rapid testing box. Make sure to store the box at room temperature and protect it from freezing or overheating. Your box should include an instruction manual, extraction tubes, buffering solution, swabs, test device, and tube holder. Next, administering the rapid test. Step 1. Start by clearing, cleaning, and drying a flat surface to place your test kit on, and wash your hands using hand sanitizer or soap and warm water. Step 2. Take out one of the extraction tubes and look for the fill line by holding the tube vertically at eye level. Grab the vial of buffering solution and fill directly to the fill line. This should only be about 10 to 12 drops. Once it's filled, place the tube in the tube holder. Step 3. Open up one of your swabs, being sure not to touch the soft tip. Insert the swab into the first nostril until you meet some resistance, about 2 centimeters into your nose, and rotate the swab 5 times against the nasal wall. Then, using this same swab, insert it into the other nostril and repeat the same rotation 5 times. Most people find this a bit uncomfortable, and that is totally normal. Step 4. Pick up the tube and place the swab inside, swirling it in the fluid 5 times while pressing the swab against the wall of the tube. Then, use your fingers to squeeze the tube as you pull the swab upwards and break the swab at its breaking point, allowing the swab to fall to the bottom of the tube. Place the cap on the top of the tube, being sure to only touch the outside of the cap. Step 5. Open the test pack and lay it flat. Then, open the nozzle cap on the bottom of the tube and gently squeeze it to dispense 5 drops onto the testing device. Start a timer for 15 minutes. Step 6. Once your timer goes off, your test is ready to read for results. You may see a line before the timer, but you must wait the full 15 minutes for a proper result. If you only have 1 line under the C, your result is negative. If you have 2 lines, 1 line under the C and 1 line under the T, your result is positive. The presence of any line next to T, which stands for test line, is considered a positive result, even if the line is very faint. If you only have 1 line under the T or no lines at all, your result is inconclusive. If you have a positive or inconclusive result, you and your household must self-isolate and access diagnostic PCR testing. Follow Laurier's protocols outlined on wlu.ca/recovery. More information will be sent to you regarding PCR testing in our Brantford and Waterloo communities. All of the waste from your tests must be disposed of according to the instructions. Congratulations, you finished the rapid antigen screening. Remember to submit your results to Laurier as outlined in the information you received about Laurier's rapid testing program. As always, please continue to use PPE, wash your hands, and practice appropriate distancing to ensure that we can keep our Laurier community safe and healthy.